My name is Jeffrey Butts, and I'm a research professor at the John Jay College of Criminal Justice in New York. And I direct an organization called the Research and Evaluation Center. And we've been evaluating models like that one, the Cure Violence model, other community-based violence intervention programs. And I'm here to tell you I'm concerned about these programs. I love these programs, and I think they are the future of public safety and the future of community well-being. And we are at a very critical point right now that they've become so popular and so politically successful that it's really easy to promote them with vague language and rhetoric and ideology. And we are threatening their foundations by doing that. That's my main concern today. If you think about public safety in this country, I've been doing this work a long time, and we are back where we were about 25 years ago, where policymakers get political benefits by rattling our cages and talking about shootings and talking about murders. And now we have social media. We all see the videos. People run for office just by accusing their opponent of not being tough enough on crime. And that's just like it was in the mid-90s. We were climbing out of that hole for a long time, and violence rates were coming down and crime rates were improving. And it's of concern to me because even the people who we think are the supporters of community-based violence intervention are using very sloppy language. For example, the federal government just invested a lot of resources in what they call CVI, community violence interventions, which sounds great until you start reading the documents, what they mean by CVI. And I did this on social media a while ago, that when they say community, what they mean is that's the objective. That's what they're trying to reduce, is community violence. A lot of people, though, see CVI and they think it means programs like Olivia's, using community-based resources, community action to improve public safety. And it does not mean that necessarily. It does include them, but it also includes policing, targeted policing, intensive policing, and a lot of psychotherapeutic programs. And all that's a contribution. We need it all, but it's really hard for community-based action, community resources to compete with those two things, law enforcement and therapeutic interventions. And that's because of the way we think about, when we think about public safety and especially violence, policymakers have a wide array of theories to choose from, but they always settle on two theories. One is that communities will be safer if we just impose our will upon people and threaten them and control them and punish people who misbehave. And two, this is the left side of that same theory, which is if we just reach out and help people and provide counseling and cognitive behavioral therapy and individual help, we can get those people to stop behaving that way. Both of those theories presume that we have community violence when some people in the community are bad people and they need to be either controlled or treated. And the problem with that is, who believes sincerely that community violence arises because of the unique characteristics of a set of individuals? It's a social phenomenon, and we don't treat it as a social phenomenon because we don't care to, we don't want to. And our policymakers make it worse. The Bruin decision is now going to have guns everywhere. In New York, that's a big thing. Our state tried to pass a law to respond to Bruin and at least replace some of those conditions. And a federal court stepped in and said, whoa, 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 let's not do this too quickly. So the whole Second Amendment thing is a huge problem. And we have a collection of policymakers who don't care about that. So we have community violence because we allow community violence to happen. So what's the answer? The Cure Violence model says if we intervene not just at the individual level, but at the community level, we can start to reset social norms, as Olivia talked about. Resetting the social norm, the analogy people usually make is cigarette smoking in public. No one here has fired up a cigarette. I would guess very few of you even smoke cigarettes. We changed the way people think about tobacco over the past 40 years. That's public health. That's public messaging. That's resetting the social norm. And it was not easy because there's a huge industry behind tobacco, just like there's a huge industry behind firearms and violence. So how do you do that? you have to aggressively go after multiple action points. Some of those action points do involve reaching out to individuals and connecting with them and trying to get them to reset their life. But you also have to focus on the broader social structure and things like economic inequities, public health, quality of schools, food deserts. All those things contribute to the stress that creates community violence. So how do we do that in a way that we can prove is effective? And that's my main message today when I say we're at a risky point because people are defending these programs with rhetoric and ideology. I spend my life and my career doing evaluations. So I evaluate these programs. And if any of you have taken stat courses or evaluation research courses, you remember the concept of explain variance and effect size and significance levels. You find a significance level when you are able to measure a difference between two things. So option A or option B, cure violence versus the traditional approach. You can measure those things. If you measure them well enough, you might be able to nail down that difference. And if I could show you a program that reduces the incidence of shootings by 10%, I guarantee you that program just paid for itself. With all the economic consequences of a shooting, you don't have to solve the whole problem at once, you just have to contribute. But even defending that 10% increment takes resources and takes clever research and analysis, because the easiest thing to do is to measure change at the individual level. That's what policing do. That's what therapeutic programs do. You get 200 people, 100 of them get the program and 100 of them do not get the program. And then you see if their behavior changes. You have a sample size that way of 100 treatment, 100 controls. To evaluate something like cure violence, it's not designed to affect the individual. It's designed to affect a community. Who's paying for a research design that compares 100 neighborhoods or 100 communities that get the program and 100 that do not? We don't see studies like that. My own center, we do studies on 3 neighborhoods versus 3 neighborhoods, for example. And you have to have a strong effect on that to detect it and to defend it statistically. So it's an uphill climb to measure the impact of public safety programs at the neighborhood level. The easiest thing to do is measure them at the individual level. So when people talk about evidence-based programs, I encounter this all the time where people, I charitably refer to them as amateurs, who say, how do we improve community violence? And they say, well, what's the evidence-based programs? Let's go to the research literature. And when you turn to the research literature and your question is, how do we reduce violence? You end up seeing lots of policing research and lots of therapeutic models, because that's how you get quick turnaround on a study. That's how you get promotion and tenure at a university. That's how you get into the best journals. It takes a long time, and it's more complicated to measure things at the community level. And the turnaround on that publication is not as quick. And you're more likely to get outputs or outcomes that are a little squishy statistically. So people who are thinking about their own careers don't want to invest their time in that question. So the literature on policing and therapy is so much stronger than community-based interventions, but that's not because policing and therapy are the best solutions to these problems. We have to see beyond all that publication bias and all those professional incentives and think about community safety from the perspective of the community, and that's still a challenge. Thank you. I want to address this issue of police program cooperation, which is related to funding, because you're correct. Most of these programs are funded through short-term grants and contracts. They're not often brought inside of city government. And short-term grants and contracts can be great because they create some autonomy and some independence, but they also can create dependence. And it's difficult for especially a small program, and especially a neighborhood-based programs, which these should all be. It makes it difficult for those programs to function. In New York, for example, we often have several months delay between the end of a fiscal year and the award of the money for the next fiscal year. And people who are making $30,000 a year don't hang around for 3 months waiting for the next contract. So it can undermine the program. And the connection with police is also very important and very risky. You're right to point out that sometimes the best way for a police department to undermine the program is to partner with it. Because as soon as the neighborhood starts to see the program staff in uniform show up at the same time, they think, whoa, this, I can see now they're wearing different clothing, but they're still part of law enforcement. I'm not talking to them anymore. And one of the value of these programs is they learn about brewing conflicts in a community before law enforcement, which is a good thing, but it's a risky thing, because as soon as law enforcement hears that someone knew about a conflict that was brewing that resulted in violence and someone in the program knew and didn't tell police, then you're also in trouble. So the best thing to do is for the program to collaborate with police at the upper level, the command level, and not to show up in the neighborhood at the same time and not be seen talking to uniformed officers on scene. It's just difficult to manage that. You want to collaborate, but you don't want to be seen as partnering. It's just a very sensitive thing. Yes. So the federal government just announced a couple of weeks ago a $100 million investment in CVI. But that's the announcement I was talking about when I mentioned the fact that that label is very broad. So one thing that could help would be specifying which component of CVI is to receive new investments. My center published a report a few weeks ago where we named this CVI-R, CVI at the roots, to try to identify programs that are really community resourced and community driven and not just community focused. So it's not just about reducing violence in the community, it's about leveraging the resources of the community. It's just complicated. So I think if the federal government was more clear about their use of language and what they mean by that, that state and local governments may pick up on it. I think right now people are tempted to have a broad label because once you see that the label includes policing, you reduce the animosity you traditionally get from police when you start talking about community violence prevention. I don't know if that's wise in the long term, but I could see why someone might do that. So it's a matter of clarifying the language. Yeah, good question. I think my dream is that every community organization and community structure would have advice about how to talk about evidence and impact. Because I think you start chipping away at that when someone brings up tough on crime and you can just calmly say, yes, but we did a program here, just describe it the way Olivia did, and then say, and the incidence of violence in our neighborhood went down by 22%. And that only cost you X amount of dollars. And for every shooting we prevented, the community saves $500,000. But just to be able to do that in a credible way. And I started off my comments talking about we're in a moment of risk because it's gotten too easy just to talk about these things in terms of using ideology and rhetoric and images. You have to deliver numbers that when that person who's out to undermine your credibility goes and looks it up, they find, oh, he's right. That did go down by that much. Until you start peppering the conversation with defensible evidence, the people who are looking to undermine these ideas will always win because all they have to do is go to the rostrum and talk about shootings and homicides, and people freak out and start voting for more police. So we have to combat the information with real defensible, credible information and not rely upon appeals to the heart, even though I love appeals to the heart too. So I'd also like to thank the organizers of this event. It's been really great. My final comment was, we can't trust programs and organizations to solve all these problems. So I really appreciate the perspective that we need to use programs and organizations to help organize community resources. And the one thing I really, really hope is that we start to see voting go up, because unless people start to vote and change the political dynamics of this country, it's really hard to see this turning around anytime soon. And the last thing I'll do is a pitch, which is our website. All our reports are at johnjrec.nyc, and REC stands for Research and Evaluation Center, johnjrec.nyc. Thank you very much.